Good evening. My name is Elizabeth Emig, and I'm going to be discussing the effects of caffeine. When you start your day or you need a midday boost, what do you reach for? Coffee, soda, chocolate, tea? These all contain caffeine, which according to researchers is the most often used psychoactive substance. But have you ever really thought about what this drug does to your body? Scientists have been researching this for years, but still have a lot of work to do. So what is your drug of choice when it comes to caffeine? Mine is coffee. I drink it every morning to get my day going, and usually around midday as a pick-me-up. If I'm feeling especially sleep-deprived or dragging, I'll go for a third cup. But despite what you may have heard, you can't have too much of a good thing. After listening to my speech, you will be better informed on the effects of caffeine before you opt to drink your third latte, rely on energy drinks to study throughout the night, or decide to binge on coffee or on soda and chocolate. Knowing the positive and negative effects of caffeine can help you answer the question of why the drink is making you feel the boost of energy, give you insight on how it may work in your benefit, and can help you prevent causing any unintentional harm to your body. First, I'll explain what caffeine is and the mechanism of action within our bodies. Caffeine is naturally occurring in several plants such as coffee beans, cocoa beans, cola nuts, and tea leaves. When we ingest caffeine in chocolate, coffee, soda, and tea. Caffeine can also be synthetically made, which we ingest in energy drinks, some medications, and supplements. Caffeine can cross the blood-brain barrier and work directly on the brain to block a certain receptor called an adenosine receptor. This receptor, when not blocked, binds with adenosine to dilate blood vessels in the brain, slow nerve activity, and facilitate sleep. Therefore, caffeine stimulates the nerves in the nervous system, causes you to feel more awake, and gives you a boost of energy. Caffeine works at its peak about 1 to 3 hours after consumption, and the effects may last for hours after. Next, I will discuss the positive effects that caffeine can have, since this is usually the most obvious reason as to why you choose to ingest it. There are some positive effects that caffeine can have in your body, though, that you may not have even realized. Caffeine can be beneficial to you hours immediately after consumption and in the long term with chronic consumption. As mentioned earlier, caffeine can cause the nerves in your brain to increase activity, which triggers a release of hormones including dopamine and serotonin. These hormones can improve your mood, which caffeine has been shown to do in a study by the Ohio Journal of Science. With this, caffeine can also reduce the incidence of depression. The boost of energy and influx of hormones that caffeine provides improves awareness and wakefulness. Caffeine can improve memory. This was demonstrated during a few studies. One by Perlacki noted increased hippocampal size, which is an area of the brain associated with memory. Caffeine can also improve learning. Studies have shown that it causes you to be more focused, relaxed, alert, and faster at reacting. According to researchers at the University of Pécs, there is an association between higher coffee consumption and lower risk for stroke, Parkinson's disorder, Alzheimer's disease, and dementia. Last but certainly not least, I will discuss the adverse effects that caffeine may have on your body. With consuming caffeine in large amounts or having an acute intake of caffeine, you may feel some negative effects. Some of these effects are not readily apparent to you but can be detrimental to your health in the future. Adrenaline is another hormone triggered to be released in higher quantities by caffeine. Increased adrenaline can cause your heart rate and blood pressure to raise, which could be dangerous over time and or if you have pre-existing high blood pressure. Large amounts of caffeine, which is about 910 milligrams of caffeine or about 10 cups of a caffeinated beverage, can cause anxiety, tremors, agitation, and restlessness according to a study done by Marcel. Insomnia is another negative effect that caffeine consumption may produce, thus also daytime sleepiness. This makes sense if the mechanism of action of caffeine is to block the adenosine receptors, which would normally facilitate sleep. An acute intake of caffeine could raise serum triglyceride levels, especially in males, according to a 15-year-long study done in Germany by Du and his group. There is some evidence that caffeine intake can also have a slight worsening bone health effect. But only if you don't ingest enough calcium in your diet, or if you're predisposed to osteoporosis, or if you're of old age. Today I've shared with you some information about caffeine as well as the positive and negative effects it can cause to your mind and body. Now that you know more about the effects of caffeine, let's review some of the main points. Caffeine acts directly on your brain, which causes a chain of events to occur in your body. Caffeine can be beneficial as it helps improve your mood, wakefulness, memory, learning, and learning abilities. It has been known to help prevent certain cardiovascular events and neurological diseases from occurring. However, caffeine can also cause negative effects, especially in high doses, such as elevated heart rate, blood pressure, anxiety, tremors, insomnia, and increased triglyceride levels. By watching my presentation, listening to my speech, and understanding what caffeine is and how it affects you, you'll be able to make an informed decision before ingesting it. As with most things, moderation is key. If you opt to consume more or less, though, you will understand the risk and benefits associated with these choices. Thank you for listening to my speech, and if you have any questions, let me know. Below are my resources.